Hi everyone, my name is Karina and welcome to UniverseSoul, a channel about psychology and complex human nature. I'm very happy to see you here. Today I wanted to talk to you about the most common myths about psychology, mental health, psychologists. So let's discuss what's true and what's not. Let's go. Psychology is not just common sense where everything is already clear, but some people mistakenly believe that psychology is not really a science because since they have a lot of life experience, they consider themselves experts in certain situations or relationships. Because yes, we all rely on our understanding of other people to navigate the world every day. But just because someone has experienced a specific situation doesn't mean that, firstly, all other people on earth fit the same template. People are different and often react to problems in different ways. Therefore, some explanations and predictions about behavior may be too simplistic. For example, some people might get violent while others don't even seem to know how to argue. And even among people who are argumentative or violent, different things might trigger these emotions and actions. You need to understand well human biology, human mind, understand how a person evaluates themselves, the world around them, the patterns of their thoughts, their inner mind chatter, what is reality for them, what culture they're from, what language they speak, and how universal this language is in terms of some psychological definitions. There's a difference between a 30-year-old white American who lives in tolerant San Francisco and an Amazonian indigenous person who is 75, and his ideas about the world are based on beliefs in spirits and how to survive in a jungle. It's also important to be able to communicate with people, not to judge them, accept the diversity of human mentality. Therefore, it's not so easy to be a psychologist as many people may think. Secondly, psychologists have long adhered to scientific thinking and they use scientific methods to understand human experience. That is proper research planning, observations, data collection, testing these findings using advanced statistical methods. A PhD in psychology includes systematic research, journal publications, governmental funding, conference presentations, and ultimately upgrades of therapeutic protocols. Mental health problems are very common among psychologists, mostly due to the emotionally demanding nature of work, exposure to stressful events, concerns about patient safety, pressure to achieve therapeutic goals, and a lack of work-life balance, sometimes complete burnout. Do doctors disclose their difficulties and seek help? Surveys show that most clinical psychologists who have struggled with depression and suicidal ideation at some point in their lives, and they also worked at the same time, were not open to discussing their thoughts and feelings, and they didn't seek help. Mental health professionals often view their problems as a weakness, and they try to stay resilient, strong, by coping on their own. They may be ashamed or afraid that their colleagues or family will judge them, that they haven't proved themselves as psychologists, they failed, and how exactly this information may affect their careers. That is, stigma is considered a very important barrier to seeking help. Unfortunately, this is a paradox of the profession. It seems that psychologists should understand their colleagues as no one else, but for some reason in real life everything is far from it. Though it's getting better and more mental health professionals disclose their worries and depressive thoughts. Also, more and more teams adopt mental health prevention programs for their staff when there are actually resources available to get help. I can add that people who choose psychology as a career, first of all, they want to help themselves. Therefore, this already implies the presence of mental vulnerability. But this doesn't mean that the person is not competent. It's necessary to understand that psychologists sometimes also require some rest, and this is completely normal. Just because they are trained in the human psyche and better understand cause and effect, doesn't mean that they will be automatically ready to any unpredictable situations and will exhibit zero emotions. Psychologists can also be raped, robbed, they can get into a terrible car accident, a partner can cheat on them, the child can die, and this will for sure shake their state of mind like everyone else's. Many people have heard or even used this phrase. The idea that people only use a small part of their brain, leaving a lot of hidden potential, is a common theme in films like Lucy, for example. But in fact, letting 90% of your brain go to waste would be rather ineffective evolutionary strategy. The brain uses approximately 20% of the body's energy. It would make little sense to have such a large portion of our energy resources utilized by such a tiny amount of the brain. Therefore, this is definitely a myth. Today, due to the development of technology, scientists see that all areas of healthy brain work all the time, even when people are sleeping. However, depending on the task the person is performing, some areas of the brain may become more active than others. Brain mapping research has yet to find any region of the brain that doesn't serve a function. Numerous types of brain imaging studies show that no area of the brain is completely silent or inactive. In other words, detailed study of the brain has failed to identify the non-functioning 90%. A lie detector can't really show whether a person is lying or not. It can only show the level of their anxiety by examining their heart rate, blood pressure, respiratory rate, and electrodermal activity or the sweatiness. By seeing changes in comparison to normal levels, many believe lie detectors indicate that person is being deceptive. People want to believe that there is a quick solution to detect lies, but there is no such test yet, and it's unlikely that this will happen in near future. To begin with, the name is misleading. The polygraph should be called an anxiety detector test. According to some estimates, the error rate reaches 40%, which is a lot. The most common mistake is declaring the innocent as guilty. Such level of errors is unacceptable in many areas. For example, in England, it's not used neither during interrogations nor in courts. However, these tests remain popular in the military, certain governmental jobs in some countries, specifically in pre-employment screening, as well as in movies and different TV shows. They are still considered by many Americans to be reliable and useful for detecting deception. In the US, polygraphs are often used for interrogation. But let's not forget that America is the country with the largest number of prisoners and those who are wrongly accused while being innocent, just because maybe they got too nervous during the questioning and confessed to something they never did. That's up to you, really. Some people prefer to lie down and not see a psychologist. The lying position can be very useful for reducing the visual noise. Someone, on the contrary, prefers to sit opposite and look into therapist's eyes so they can feel the connection. Nowadays, walk and talk therapy is gaining popularity, especially in private practice. This is when a patient goes for a walk with a psychologist during a session. Since many dislike sitting in a cramped room, they feel squeezed mentally, trapped. It can be a trigger for someone with post-traumatic stress disorder. Or some people think that they being like in a mental health hospital and they feel a bit crazy, so they struggle to talk. So it's easier for some people to open up outside in nature, somewhere near a lake or in the park, but the place, of course, still should be relatively crowded for safeguarding of both the therapist and the clients. This is definitely a myth. When people with mental health problems commit violent crimes, the media takes a huge interest, calling them psychopaths, schizophrenics, with headlines like "he dismembered his own family in a manic attack." No wonder most people think that those with mental illness are prone to violence. But in fact, 90% of people with mental health problems don't commit violent acts. They're rather dangerous to themselves, not to others, and the chances that they will harm themselves are very high compared to the possibility that they will hurt someone else. Parallel to my private practice, I'm conducting research on conduct disorder in children and adolescents. This is an aggressive or antisocial behavior when children constantly lie, bully others, hurt animals, steal, get into fights, set fires. And my observations show that those with a history of psychosis are actually the least susceptible to conduct disorder. Unfortunately, this myth is the main reason for mental health stigma and misunderstanding why someone commits violence. But I will make separate videos about this because the topic of criminal psychology is very broad and it's impossible to summarize it in 5 minutes. Many people believe that domestic violence is overwhelmingly committed by men. And yes, it's true. But there are other stats which show that violence and abuse by women is also a very serious problem. 1 in 4 men have actually experienced either physical abuse or sexual manipulation, or financial abuse, emotional abuse, harassment by a partner or their ex-partner when they turn into stalkers. I am in no way trying to reduce the severity and the scale of the problem of violence committed by men. But it must be recognized that there are also these lesser known facts related to violence by women. Violence or sexual abuse perpetrated by women can be ignored due to the general assumption that women are usually very gentle, caring, emotional, and that the social structure of men is something competitive, aggressive, strong, dominant. But women can also lack empathy, beat the children up, expose them to drugs, to prostitution, especially in third world countries. Women can kill with extreme cruelty. The main message of this myth is not to think in stereotypes. Not all men are alphas who destroy anyone, and not all women dream of caring for their families and being a mother. During a hypnosis session, people go through a process that induces a trance-like state that helps them focus, respond more readily to the therapist's words, and deeply relax. Most hypnotherapists use a series of calming messages such as "you are safe and no one can harm you" to convince their clients that during hypnosis they can objectively face their fears or problems, but without panic reactions. You may be taught certain cognitive behavioral coping skills, for example, when trying to quit smoking or working out relationships with your parents. You may be encouraged to talk about how you first experienced a problem or situation and how you felt at that time. Some people can get very impressive results. Other times, people may just feel very relaxed. But in some cases, hypnosis can cause false or distorted memories. Examples of this phenomenon can range from rather innocent, such as the wrong memory of whether you closed the front door or not, to much more serious, such as false memories of the details of a car accident you witnessed. If during hypnosis the person was asked to recover episodes of violence and remember something, they may begin to exaggerate or experience difficulties in separating some events from reality, from what really happens. Research shows that people who restore false memories are very prone to suggestion and dissociation, that is, to a sense of separation from real experiences and their bodies. Some people may also experience other side effects such as anxiety, headaches, dizziness, and even nightmares. Hypnosis can harm people who are experiencing positive symptoms of psychosis, hallucinations and delusions. Whether or not visit a hypnotherapist is up to you really, and depends on your situation. Most importantly, remember that hypnosis is not a magic pill to uncover clear repressed memories, and if you're an easily suggestible person, it's probably not for you. Schizophrenia is a very serious mental illness characterized by distortions in thinking, perception, emotions, language, sense of self, and behavior. Common symptoms include hallucinations, usually auditory, but there may be others, and delusions. For example, a person may believe that someone inserts thoughts into them via a TV or communicates with them using a secret language, or vice versa, they pull the thoughts out of them through TV or radio waves. All these in addition to other symptoms such as erratic speech, difficulty expressing emotions, difficulty with motor skills, which often lead to impaired social life, job loss, and falling down the social ladder. Yes, people with schizophrenia may hear or feel things that aren't real, or believe things that may not be real, but this is not a split into separate personalities. Dissociative identity disorder, or DID, is also actually not a multiple personality disorder, but rather is concerned with one fragmented personality than with many different personalities developing on their own. That is, all personalities are extreme aspects of one person. A key part of DID is dissociation, a feeling of detachment from the world around you, often due to some serious trauma when a person begins to wander in their thoughts and invents a life that doesn't exist in order to somehow digest all the horror in which they really are. Such people can have many gaps in memory, forget information, or have difficulty remembering what they said or what they did. Unlike to how DID is portrayed in films, it's not always that obvious, and it can take a long time to conclude a diagnosis. More than 80% of people believe that mental illness is caused by a chemical imbalance in the brain. But in fact, no one really knows what this ideal balance of chemicals should be, and whether disorders are caused by fluctuations of neurotransmitters in the brain, or whether it's psychological problems that cause a chemical imbalance in the brain. Basically, it's a question of chicken or the egg. Support for the imbalance idea comes from the fact that, for instance, antidepressants alter the levels of neurochemicals in the brain, but that doesn't necessarily mean that chemical imbalance alone causes depression. We don't fully know why these drugs work, and such claims they simplify the etiology of mental illness and focus only on symptoms and their elimination, not on the core of a problem. To make matters worse, the idea that chemical imbalance is the root cause of mental illness may lead to people thinking that taking medication is the only effective treatment. But these medications often cause a number of side effects, like drowsiness, nausea, weight gain, sexual dysfunction, nervousness, just few of them. Of course, I don't deny that medications sometimes play a very important role in improving someone's mental state, but it needs to be a specific mix of meds and in specific doses for that particular person. But not all psychiatrists dedicate their time to such individual approaches. Often, psychiatry ignores social environment of a person as well, which can play a major role in their psychological problems. It becomes insignificant whether their childhood was abusive, maybe their mother died when they were 6 years old. Was there an opportunity for them to access education or not? How they earn money? Do they know how to earn it? What are their interests in life? What dreams they have? Is there any pressure from anyone? Do they feel loved by people around them? These questions are often not considered, and psychiatrists simply prescribe the basics so people calm down and they stop bothering others. This actually opens up a Pandora box, asking whether mental illness really exists or is it just an inconvenience to our societal norms. You are more than welcome to open a discussion in the comments below. To begin with, we need a complete policy change on how we diagnose psychological disorders. And instead of just asking people, what are your symptoms? We need to ask them, what happened to you? What's your life like? Thank you for joining me today. I wish you a fantastic day and I see you soon. Bye.